those common obstacles that severe patients with ME/CFS or other severe IACCs face when attempting to join a clinical study?
Maybe I'll go first on this one. So I looked at this through a really practical lens, both as a patient who struggles to access the studies and also as somebody who's working with the researchers and having these conversations about how we can do better. And some of the common obstacles that ME patients face are sometimes even finding out about the studies. So for example, if you're announcing a study through a clinic or a particular clinician and the announcements are in their office or going through their email to their clients, it's going to be very hard to sort of expand that to an audience that's going to reach severe patients. Finding out about the studies on social media can help a bit, but as we know, the platforms are changing so rapidly right now, and our community is struggling a bit to find where it's going to land in those platforms. But certainly we can do a lot through platforms like Blue Sky to be able to promote studies and make sure that we're hashtagging, we're connecting some advocates, some key people to those posts. And then, for me, I vet every study that I'm asked to promote. And if it feels like a safe or reasonable study, then I will promote that out to my network. And so I think really using the community to the best of our ability is really an asset we have. The process for getting involved in studies is actually quite complicated often for us. So number one, sometimes the actual ads or promotional materials can have QR codes that we can't access or click on. They can have links that we can't click on, emails we can't click on. And then the eligibility isn't clear. So we have to contact and ask 5 questions back and forth. It's a lot of back and forth cognitively for severe patients or their caregivers if they're getting help. And so we really need to make things really simple.